Welcome to the Aesthetics Today podcast, the premier platform where we explore the ever-evolving landscape of aesthetic treatments, regenerative medicine, and cutting-edge beauty products and technology.
Hi, welcome to the Aesthetics Today podcast. I'm your host, Gabrielle Richens, and before we dive into today's episode, I want to give thanks to our sponsor, Digital Aesthetics, the UK's foremost specialist agency for health and beauty clinics marketing. Today's guest is someone who has quietly built one of the most respected clinics in London, without chasing trends and without compromising on standards. Flavio Refrigeri is the founder and clinic director of Fiore Aesthetics in Covent Garden, an award-winning medical-led clinic known for its safety-first approach and consistently natural results. With over 16 years of clinical experience, Flavio brings a depth of knowledge that goes well beyond aesthetics. His background spans emergency care, surgical dentistry, and advanced aesthetic medicine, supported by a level 7 qualification in aesthetic practice and a master's degree in healthcare management and complications. So for him, this isn't about treatments, it's about clinical judgment, risk management, and understanding the skin at a far more sophisticated level. But what really sets Flavio apart is his philosophy. He's a strong advocate for moving away from overdone artificial looks and back towards skin health, regenerative treatments, and subtle, intelligent enhancements. Alongside running a busy London clinic, he's also a regulated educator and assessor, helping to raise standards across the industry, teaching practitioners not just how to inject, but how to think ahead. He also hosts the Aesthetic Effect podcast, where he continues to unpack the realities of modern aesthetic medicine with clarity and honesty. Welcome back, Flavio.
Oh my God, what an intro. Is it me? Wow.
Yes, it is. You are impressive.
Wow, that was amazing. Thank you so much for having me.
Thank you for coming back. It's been a few years since you were on.
Yes.
2.5 years to be precise.
Yes.
So let's catch up, because the last time we spoke to you, you were very clear about wanting to keep your clinic, Fiore, boutique, keep that boutique feel.
Yeah.
Right?
Yes.
But at the same time, you've got to scale your business. So how has that panned out in the last few years for you?
So since we opened Fiore Aesthetics, literally 16 years ago, funny enough, yesterday, it was Clinica Fiore's birthday.
Oh, wow.
So we literally
16
been over
years.
16 years on the 10th of May. And the funny things as well, since the day we opened, I always wanted this clinic to be a little bit different from others and to make sure that patients are cared and loved the way they should. So the way that we have jumped into this new project lately is just to care for patients, love the patients in a different way. So to me, it's not about a number. It's not about treating patients just like 1, 2, 3, and 4, but it's actually to get that connection with them, you know?
Yeah.
It's
I can imagine that your patients must feel very special.
Oh. And I think everybody's special. We need to make people feel special these days, you know. And I think it's important to really build a good relationship with them, with patients, not just consider them just a number, really. Yeah.
So you've been able to do that then?
I have. We moved actually so we used to be in Covent Garden. We still are.
Right.
But we moved from a larger clinic to a little bit of a smaller clinic.
Right.
So I've kind of remodeled my business slightly bit, and it's been a good success.
That feels maybe more personal as well when it's smaller.
It feels more personal, smaller. Yeah. We can look after patients even better.
Yeah.
And give them the love and support that they need.
Lovely. Yeah. So the aesthetic industry has also shifted since you were last here.
Yes.
I mean, you were probably doing regenerative treatments back then, but I think it's just gone full force, hasn't it? Are you seeing a change with what patients are coming in and wanting?
Oh my God, massively. So when I started, literally 16 years ago, I don't want to drag it to 16 years, but 16 years ago, the industry was completely different. It was all about, feeling as much as we could and make people, just using basic techniques, really, just hyaluronic acid to be able to create some sort of rejuvenation. But now patients have gone the opposite, which is actually a nice thing. We've gone through a change of natural results, a change where patients just want to look fresh, They just want to look the best version of themselves, but to still look like themselves, you know.
Are you doing less filler?
Right. Yes. The answer is yes. But I still believe, as much as all the congress that I go to and meeting that I go to, everybody says we're moving away from dermofiller. I feel that dermofiller has an important place within the industry, but we are definitely moving away from it.
Because what would I do about my lips if you stopped doing filler?
That's it. And how can you create volume without, dermofiller? So I think dermofiller has an important place still.
But it's definitely changed how you guys are actually, doing it.
I think patients these days, really, they just want to feel the best version of themselves, fresh, without looking too, let's use the word artificial. By the way, if someone wants to look artificial, it's fine. But what I mean, I think people these days...
It's improved, hasn't it?
Completely,
Yeah. Right, let's get into education.
Let's do it.
Titles and the aesthetic practitioner.
My favorite subject.
So first of all, let's talk. So you are a trainer, you're an educator. You've been doing this for like 5 years, haven't you?
Yes.
Or longer?
So thank you for asking me that question. It's important. So I've been actively training for probably just over 5 years. And I've done it's called DET. So I've done my diploma in education and training. So I went through a year and a half for training to become a trainer. So I had to do, designing courses, and I had to do 100 hours of supervised teaching to get my license. And for the past 5 years, I've been doing a lot of training, so for healthcare professionals in general, and I've been training with a company called Sky Medic as well, UK, and I've been running some of their courses, so I'm very passionate about education.
Yeah, you are.
Yeah.
So you've got inside knowledge of the whole aesthetic education system. I want to ask you, because what does, I'm speaking for the people that are watching that have got no idea about aesthetics and how it all works. We see the term aesthetic practitioner used a lot, but what does it actually mean? Who can be an aesthetic practitioner?
Wow, that is a wonderful question. So an aesthetic practitioner, when you're breaking it down, is someone that perform aesthetic treatments. And I feel that terminology is used quite freely these days. An aesthetic practitioner is someone that comes from healthcare professional background, so has a registration with a medical entity, GMC, GDC, or the Nurses and Midwife Council, or are practitioners that they don't come from a medical background, but they decide to go into the industry.
Right.
And I feel strongly that an aesthetic practitioner should have proper training, proper education to be able to call themselves aesthetic practitioners, because I believe that you can't become an aesthetic practitioner by doing a day course.
So what qualification do you need? Obviously the medical side of it, but then so if you've just got that medical degree and you're a nurse or a dentist, you can then just go on and be an aesthetic practitioner.
Right. So again, very, very good question. At this point, you can. Right. At this point, anybody that has a license, they can just do a course really and become an aesthetic practitioner, call themselves an aesthetic practitioners. I still believe that to make the industry a better place, to make the industry safer for patients, and to make the industry just regulated, I feel that regardless of your background, everybody should go back to study. What I mean with that is that there should be a course, which there is coming, like a level 7, which is a master degree level of post-graduation level course, where it might take a year, it might take 2 years, depending on your background, where you study again from scratch your toxin, your dermofillers, your mesotherapies, your skin, your anatomy, and so.
Right, because maybe those people haven't actually done that qualification.
You got it. So if you think about someone that comes from a healthcare background, so I'm registered with GDC, I've got a number with them. But if you're a nurse, if you're a doctor, that you worked within a medical field, it doesn't automatically make you an aesthetic practitioner because you never studied that, you never performed that. So if you worked as a nurse for the NHS for the past 15 years, that's amazing, that's great, you've been saving lives, it's wonderful. But when you were doing your nursing degree, or when you were working as a nurse or as a doctor, you have never, ever touch the subject of aesthetic, skin, how the skin works, and treatments in general, techniques.
Yeah.
So I feel that regardless of your background, I think everybody should go back and do a
And
standard
do the level
course.
7.
Level 7 is a good starting point. So in the UK, level 7 means that, so different levels, so level 5, 6, and 7. So level 5 is just a degree. So anybody has a bachelor degree or a science degree, that is called a level C, a level 5. Then you can do your level 6 and then your level 7. Level 7 is more of a master.
Is level 7 a new one?
Kind of, yeah. It's becoming quite popular now in the UK. For example, in Italy, where I'm from, up to a year ago, if I'm wrong, hopefully I'm not wrong, people not judge me for that, but I think only doctors were able to perform treatments. Now dentists can as well.
Right.
But now they're introducing in Italy you say obligatory or you say compulsory?
Yeah, compulsory.
Level 7, which is a master. And England is following. Is following. So to be able to perform aesthetic treatments when the new license scheme come through, you're going to have a level 7 to be able to perform these treatments.
That's good then, isn't it?
I think it's going to be amazing because it's the only way to be able to create a field where everybody is trained more or less at the same level. And I think for patient safety, it'll be phenomenal.
Why do you think that so many nurses and dentists and doctors are getting into aesthetics, or they have been for years? Is it?
I love that question. We can talk about this for quite a while. Right, I feel, please people don't judge me, you have two types of practitioners out there. And I always say this, you have the part-time practitioner, someone that still works within either the NHS or whatever, and then they just need extra money.
Yeah.
So they go to do a course,
a
couple of days, and then they do a little bit of filler and a little bit of
part-time,
whatever part-time.
Yeah.
Which is fair enough.
Yeah.
Nothing wrong with that.
Yeah, my Botox lady, she is a nurse, and I love the way she does my face. Yeah.
And you look beautiful, by the way. So she's doing an amazing job. And then you have your full-time kind of practitioners. So I think you have two different type of practitioners. And the one that is doing it full-time is the one that will constantly training themselves and constantly go to courses and keep themselves updated all the time. I mean, I don't mean that somebody doesn't do a full-time, doesn't do that. I'm not saying that either. But I think there's two type of practitioners out there. The one that they invested their full career on a full-time basis, and then somebody just does it here and there.
Right. When you're an educator, so when you're actually assessing practitioners, what is there a lot of problems you see here? Is there a gap in the education system? Tell me a bit about the education system.
The first thing that I would probably say confidently saying this, that the main things that I see is really lack of education, a lack of training. You find a lot of practitioners that, again, regardless of their background, if they are healthcare professionals or not, they come through the doors really not knowing a lot.
Right.
And I know that a lot of people, everybody starts somewhere, but go back to the education side of it. I think if we had a different type of education, meaning that everybody, regardless the background, had to go back to school, I think everybody would be more prepared. And everybody would be more aware.
And your job essentially would be not easier, but it would probably be a bit different for you when you're training people.
Yeah, because you find that then again, go back to the point of title. You find that a lot of people. I'm not saying they come in with the title of I am this, I am that,
like a doctor or a nurse.
You said it yourself. But then actually when it comes to the aesthetic side of it, the knowledge is very low. So I think that if you want to pursue this kind of career and it's something that you're really passionate about and you love it, I think, everybody should go back and do proper training, proper studies,
Yeah. And with the whole regenerative treatments and this whole change that's happened, How do you see that there are gaps with that sort of training now? Is it different than what you were doing before?
So definitely, so the world is definitely, the study medical field is definitely traveling towards the most natural way, regenerative way. So we perform more regenerative treatment now that we done in the past. And I feel that under that perspective, people are so interested on polynucleotides, so exosomes and
what's
hyaluronic
Sky
acid.
Medic's like their top treatment?
So I would probably say Sky Medic is a wonderful company, and they specialize in regenerative. That's what they do. So the courses that we run with them are all based on regenerative biostimulation treatments.
Right. So that really is all you're doing with them?
More or less. I would probably say more or less that's what we do. Polynucleotides and exosomes and hyaluronic acid, different molecular weights. So it's brilliant. It's a wonderful field to be in.
Right. And you're a KOL, so a key opinion leader for Sky Medics. What does that involve? The training? Do you have anything to do with when it comes to the new products that are coming out? You do?
I do.
How exciting.
I do. So for example, like if they, so just to say, Sky Medic, they are still a family-run company, by the way. They're big all over the world. I think at the moment they're like
US,
they're everywhere. Like it's a Spanish company to begin with, still run by the family, but they have their own labs, their own pharmacists, their own chemists, and their own doctors, and they really formulate the formulas themselves. Number one, which is a great thing. And they're based really everywhere. Whenever they have like a new product, they always like bring me a little sample and say, what do you think? And I'll try on a few friends or few patients or myself.
Give your feedback.
And give a bit of a feedback. It's not everything works. Sometimes they have to reformulate their own formulas if things are not correctly done.
Do you like that? Do you like that side of your business?
I do. I think education for me is probably the things that I love the most. I still love performing treatments. I still love seeing patients. I still love being in clinic. I feel very lucky and privileged because I absolutely adore what I do. But I think education really sticking a big love.
Do you think as you go on, maybe it's something you'll get even more involved in?
I would love to. I would love to think so. I would love to think
so. Okay, so my last question on this topic is, if you had to set a mandatory exam for every new UK aesthetic practitioner, what's the first question you would ask them?
Oh my God, that is a question and a half. What would be the mandatory question? Oh my God, this is actually, it's a bit of a joke, but I'll tell you one quick thing. So I had a class a couple of weeks, I'll go back to your point. I had a class a few weeks ago and it was all medics, so meaning like healthcare professionals, all nurses and doctors. And I was talking about G prime and double G prime, which is the viscosity of a product, the way it travels, the way it bounds when it comes to dermophilus.
Okay.
And this room was...
I learned so much on this podcast.
and this room was full of practitioners that they should have known.
Right.
So when I was talking about G prime and G prime, double G prime, and so I could see some faces that were a bit, unsure. So first question I will put mandatory is learn about G prime and double G prime when it comes to density of hyaluronic acid. That would be a mandatory question.
Okay, I'm glad I know that now. I'm going to ask next time I go in the clinic.
You should. What product are you using today? What is the G prime of my product?
So going to ask that.
They're going to be shocked.
They will be. I need to make a note of that. Okay, right. Let's talk about my favorite topic, treatments and technologies. Ooh. So, because they've been evolving, right? As we spoke about before.
Yes.
Now, you've got certain treatments like chemical peels and microneedling that have actually, I did a little bit of research. They've been actually around for 150 years.
Long time.
It's insane. And microneedling actually happens to be one of your favorite topics, one of your favorite treatments. You're really passionate about it. Tell me why you love it so much, and then I obviously wanted to talk, a little touch on the research you're doing.
Thank you. So everything that we do within the medical aesthetic field in general, so I know a lot of people are going to watch this, they're going to go before that with the conversation, but everything that we do is to trying to create a control stimulation or a control injury or a control inflammation, and that's what instigates your fibroblasts to be a bit more active, or your collagen production and so on. So I feel the microneedling or skin peels are the perfect treatment when done properly and correctly to really stimulate that regeneration without being too aggressive for patients. So I like my patient to have a treatment done, like with microneedling, and get good results. But at the same time, I want them to be able to go back to normal life pretty much as soon as possible, right? And I think the microneedling, because it's been performed for so many years, and there's a lot of papers and a lot of research out there.
There's a lot of research on it
To back up the statements, that when it's performed correctly, when it's performed by someone that's been trained properly, microneedling can really do magic. When it comes to just skin rejuvenation, or for fibrotic tissue rejuvenation, or potentially for scarring, postpartum scarring, acne scarring. It's a wonderful, wonderful treatment when it's done properly.
But isn't that interesting that the oldest treatments are the ones you love the most?
You know, you said it completely right. I always feel that sometimes, you know, when we go to conferences or meetings and stuff, it might be the same. I always say, my mom always says, it's the same soup. It just, you turn it left or you turn it right. And I think sometimes with treatments, more or less, when you go to the core of it, when you're analyzing it at the core of what actually the treatment does, it's always the same thing.
They're all doing the same thing.
They all go back to the past injury-based treatments with needles or chemical injuries. So it's kind of the same. It's just that people will add on a few things to make the treatment look bit better or
and
a
do
little
you
bit more fancy.
use, have you got did you Morpheus 8, or is it, I know there's different types of them, isn't there? Yeah,
Morpheus 8 is a brand, and the treatment is called microneedling radiofrequency, which you're using needles and heat. I love it. I know that I did a video actually about it not long ago, about this very well-known plastic surgeon that, we're not going to say names, that he was going against it, saying that, it creates a lot of damage when it's not performed correctly. But I disagree with that. I think microneedling radiofrequency, or also known as Morpheus 8, if it's performed, again, correctly, if you're choosing the right patient with the right, skin, with the right skin.
And you'll go in the right depths in the right areas as well.
With the right depth, in the right area, it's a great treatment.
I think with that whole Morpheus 8 ruined my face thing that's just all over the internet, I think that as a client, as a patient, as a consumer, we have to do our research. We have to go to reputable clinics. It's so important.
The funny thing is, you touch a very good point there, because you said, sometimes, I'm sure there has been cases, and I'm not denying that there is no cases out there where Morpheus 8 or microneedling radiofrequency has potentially, the main point was fat reduction, right? That was the main thing. And I'm sure that is real. I'm sure that happens for real. But it can happen with any other treatment that you perform when you're not wrongly.
And you're not qualified in it, or you're not experienced.
Exactly. You have it. So what happens there is the depth of the needle. So not to be too technical, but if you penetrate your skin up to, you're passing about 4 millimeters depth. In books, 4 millimeters where the fat layer sits, the superficial fat layer sits.
You're going to get rid of the fat.
You are. So if someone is not well trained, and someone, a practitioner, they might think, I'm going to give a good old treatment there, my needles. What you do is that you will shoot that heat into the fat layers, and therefore you will lose fat. And we want superficial fat.
Yes, we do.
We want it, That's what makes us looks young, So
plump is young.
You gotta go. That's it. But the thing is that I always feel, if it's done properly, if it's performed by someone that knows the settings, and most importantly, like I always say, the secret is you have to be able to know how to choose the correct patient. That's number one. You can perform this treatment, microneedling radiofrequency, to 100 people, but if you don't pick the right patient for that treatment, you're going to create damage or not results at all.
Of course. And that, and I mean, that can be done in a lot of other treatments as well. But Morpheus8 is kind of like all over the internet for that.
I love it.
It's like forums on it. It's like all over Reddit. Morpheus8 ruined my face.
I've read it so many.
Yeah, I bet.
I think the fat dissolving is probably the most kind of like the most controversial side of Morpheus8. Listen, I performed so many.
Yeah.
And let me tell you that, like, I don't recall one person coming back and say, "Oh, you remove all my fat."
Yeah, but they wouldn't do that with you. It's the either the inexperienced practitioners, isn't it?
I think as well, we can all make mistakes. I mean, like I would probably say, like, when it comes to needling, microneedling, and especially like the Morpheus8 situation, I'm very cautious about, treatments and things. But even I think when you're performing a lot of treatments, even the best of the best, things can go.
Things happen.
Things can happen.
Are there any treatments that you refuse to do, that you don't do in clinic?
Yeah.
Really? What? The liquid nose job?
That for me is a no.
Really?
Yeah.
Why? Tell me.
Right. I feel that as an aesthetic injector and practitioner, you have to know your limitations, and you need to know when to say no. It's a good, powerful thing to say no, and you have to know your limitations. And I feel that like I know what I'm comfortable and good at, and I know what I'm not really good at, just because it doesn't come natural to me. And noses to me is one of the most dangerous.
Really?
It's super dangerous. Imagine like a little statistics. So in the UK, in the past 12 months, like they say 7.7 to 8 million treatments are performed, what is recalled normally. And the most well-known, it's not contraindication, but the most well-known going wrong area, mostly for vessel occlusions, is always mostly the nose.
Really?
It's very dangerous. You've got your columellar artery, you've got the supreme artery, you've got some major vessel on the nose, and it's extremely simple to put a little needle and to create an occlusion. So I'm very cautious, and I made the decision a few years ago. I was trained by a very good friend, an amazing plastic surgeon, Roberto Amore from Love Cosmetical, and he trained me a few years ago and stuff, but I never felt comfortable doing it.
Right, you didn't enjoy it.
So I've decided to send, if someone wants it, I've got lots of nice friends in the industry that can do it. So
if it goes wrong, what can happen if it goes wrong, if there are complications?
Right. So the main complication that we always worried about is always what we call a VO. So it's a vessel occlusion. So it's when a vessel is being compromised, either by being blocked by dermophila product or by being pressed, right? Compression. The nose, because the function of the vascularity of the nose is very intrigued, you've got different type of arteries all around, and it's a small place. One of the major arteries fits the eye, so it's called the ophthalmic artery, which goes around the back. So if you were to inject even the tiniest amount of product into that artery, very quickly you block the passage of blood, so oxygen, and you can get blindness very easily.
That's really worrying.
So that is very worrying. And I'm sure, and I'm not saying that practitioners shouldn't do it. I'm sure there is some amazing doctors and nurses, practitioners in general, they can do it every day, regularly, and they're great at it.
Yeah.
But knowing the risks involved, I've decided not to do it. I like to sleep at night. I like to go home and sleep.
I don't blame you. Keep it as simple as you can.
But it's a very problematic. It's a very difficult area to treat.
Interesting. I never knew that, because you see so much of the content, and the before and afters, obviously, for the liquid nose job is amazing, isn't it?
Amazing. I mean, the funny thing is, talking about that, you have to really choose the correct patient for it. So with the liquid rhinoplasty or non-surgical nose job, we are not removing any tissue.
Yeah.
We're not making it smaller.
Yeah.
We adding product. So what that means is that we create an illusion of the proportions and balance of that nose that will look better by making it sometimes bigger.
It's very clever.
But the proportion and the balance and the way the light reflects make the nose look better. So it can be life-changing for a lot of people. But I still believe that as practitioners, we should know our limitations. So we know that we can send them somewhere. We can send them somewhere else.
Yeah, and I'm sure you know a lot of people that do that very well. Now, I want to talk about hair stimulation, because this is another thing that's in your practice, and it's something that you've spent a lot of time and research on. PRP and exosomes. Now, we had an interview with a hair transplant surgeon, which was, a really interesting chat, actually. And they steer away from them, but you tend to do them, don't you?
Oh, my God, absolutely. So there has to be an understanding of the treatment that you're performing. So not every treatment is appropriate for every patient, right? So before we start, I always say everybody's different. So, there might be a candidate that PRP or IPRF will work really well, and some other patient that won't work really well. I feel that when it comes to hair restoration or hair stimulation,
what's the difference? Is there a difference?
The way that I see it is that the hair restoration, in my opinion, people might disagree, is when you're restoring the area. So mostly it's a transplant. So we're taking a follicle from an area and we are replacing it into another area. When we're talking about stimulation, is when we are stimulating the area by using a product like your IPRF, your platelets, or a mesotherapy cocktail. One stimulates and one restores. So I think that is how I put it within my practice.
That's interesting, because I guess with the hair transplant, they're putting stuff in.
Correct.
So you're more stimulating what people already have.
Exactly. So, and if you find that, if I've got a patient that come through my door and they've got some severe type of alopecia, or they might have some hormonal condition or whatever it is, and the follicle is completely gone, so you're looking at the scalpel and it's quite empty, we have to be realistic and most important, be honest with the patient and say, well, we can give it a go, but if the follicle is not there, there's nothing to stimulate. So choosing the right patient in this case is key. So for PRP and IPRF, I feel that after a transplant, phenomenal.
Really?
Because you are transplanting a follicle from one place to another, but a lot of times the environment that we are placing the follicle in is not healthy to begin with.
You need the aftercare.
Exactly. So IPRF or PRP not only will stimulate the follicle, but it will create a healthy environment for the follicle to live in. And if I place something from here to here, but the environmental state of that tissue is not healthy, that follicle probably won't survive as good, or it won't be as strong as. So mesotherapy or IPRF or PRP, it will make sure that the follicle is healthy, but the environment of the follicle is healthy also.
Is there evidence for that as well?
PRP and IPRF are probably two of the modalities mostly studied ever.
Really?
I mean, there's so many papers and there's so many scientific papers behind that. If someone says, well, they don't do much, I will probably question that. And I will probably say, well, if you go a bit deeper than that, I always say, if you have two brothers, two sisters, or two friends that they're going through the same medical condition, and they both go to the same hospital to get treated, same doctor, same therapy for the same condition, you might find that one person of the two responds beautifully out of that therapy, right? The same person, the second candidate, the second patient, same condition, same doctor, same therapy, but they don't respond so well. So you're thinking, well, why? We are performing exactly the same thing. So why X got such an amazing results and Y has not? Because it's how you react to it. It's how your body will react to that. So PRP is the same thing. So we can't guarantee that if you see 100 patients, all 100 patients will respond beautifully to it. But what we can say that there's so much back research behind it that we know that HIPRF works.
Yeah, you get good results.
But then you might find that out of 100 people doing the treatment, 60 get stunning results, 20 not so much, and the rest not at all. Sometimes it's just how your body will react to that specific treatment.
Right. Interesting. Now, what new technology, since you were here last,
Yes.
tell me about any new technologies and treatments you've brought into Fiore.
Oh my God, let's think about it.
Has it been a lot in 2.5 years?
Well,
or are you
no,
quite...
actually, I would probably say the new things that are brought in is definitely polynucleotides, so PDRN, exosomes, which they're here to stay. They're not going to go anywhere. So I'll probably say the two new treatments that we've got is definitely the polynucleotides and the exosomes. I will probably say
the exosomes, that treatment would be microneedling, wouldn't it?
100%. I think there isn't, I'm sure there is some countries around the world, I think Korea, for example, that they are allowed to inject, but absolutely in the UK.
Well, I listened to your podcast with Dr. Roberto, the inventor of EndoLift. Such a great episode.
Yeah.
And you guys talked about this, and he said, the best results you're going to get with exosomes is, superficial.
Superficial.
Yeah.
So the study, probably a lot of people listening to this podcast today, they're probably not going to agree with me. Some people, they will agree with me. But exosomes in general, so just to go back a little bit, I'll give you a little, this is actually quite a nice thing. So exosomes were discovered in the 1980s, right? So it's nothing new. And the first studies, they thought exosome would just waste. It would just cells removing waste from it. And then in the 90s, early 90s, and so they started to study in 2000, started to study properly, and then understood the importance of actually exosomes, right? Cell communications, transportations, and so. So they've been there for a long time. It's nothing really new. But I think when it comes to the aesthetic side of it, we still don't have a lot of papers, and there is not a lot of research on the aesthetic side of it. And that's why people get confused. But one thing that we know for sure is that exosomes love to be superficial. So as soon as you have an entry point, they love to travel themselves. They have this ability to understand where to go by using these receptors. So a very light entry is good for them to travel. So microneedling is definitely a good way of using exosomes. I love them.
Okay. What are your favorite treatment obviously is microneedling. Any other like HIFU, software? Do you guys do any of that?
Yes. Oh my God, yes. Then again, HIFU. A lot of bad press about HIFU. I love it. Some plastic surgeons, they just go, no, it's rubbish. Of course, they need to do surgeries, right?
It's cutting into their paycheck.
That's it. I feel that HIFU, again, it's wonderful. And, when it's done properly and when it's, with the right patient, with the right settings, can work really well. I do believe in my practice, for example, I love what we call a hybrid or combination. I love that. So a combination treatment path for me is the way forward. You're looking at someone's face and you think, okay, you're looking gorgeous. So I'm looking at you as an example, but you're like
tell
that.
Me what, yeah,
you're
tell
like
me what
that
you do
already.
To me. Yeah, what would you do
nothing.
To me?
You look
we
at
need
me.
some snatching going on under here.
You snatched already, so there's nothing to snatch. But I feel when you're looking at someone's face, you might do a little bit of soft wave or a little bit of HIFU, maybe to tie the muscles around the jawline.
It's very HIFU. I find very effective. I did have it done a few years ago, and it really boosts your collagen as well. It's amazing.
1,000,000%. And I think sometimes when you might, like what I do with my patients, I might do like an HIFU treatment, then they will come back a month later and I will do some microneedling radiofrequency for skin laxicity, and then I do a little bit of PDRN. So when you tackle the problem with few different treatments, it's
that's
phenomenal.
The key, isn't it? I know we had Zunaid in here, Dr. Zunaid, and that's what he said. It's all about combination treatments. You don't just do a one-off treatment. It's a journey, basically.
Yeah. Zunaid is wonderful.
Yes.
I think he's one of the sweetest and one of the nicest doctors out there. Is adorable. And I feel what he said is completely right. You have to do combinations. The old-fashioned thing of
having
a clinic and you do 3 treatments, you do pum, pum, pum.
Yeah.
And
people also I think that as a patient, I like to see, oh, that looks good, or this looks good, and then I'll go on and I'm kind of booking myself in for things. And I think patients do that a lot. We're just like, okay, we'll book in for this one treatment, and you go and you have it done. Whereas now I've been talking to all of you guys, I'm like, okay, I'm going to do a patient journey. I'm going to, do the combination.
Do you know, then again, I'm glad you asked that question, because we're going through social media trends, right? Where, something goes massive on TikTok or something gets huge on Instagram, and everybody wants that treatment, and they're gonna come into the clinic and say, oh, my sister done it, or my brother, oh, I want it.
Yeah.
But it might not work for you.
Yes.
So, it's not about what you see, but what you need.
Exactly. Yeah.
And I think when you go into a reputable and an experienced practitioner, someone that actually can sit you down and say, right, I know you want to have that lovely treatment that your brother or sister or whatever, but it won't work for you. This is what you need.
Yeah.
And have a conversation, educate them.
Yeah.
That,
it's important, isn't it? Yeah. People just really don't even know what they need sometimes, most of the time.
Well, do you know the funny thing you're saying that? These days with ChatGPT, people think they literally...
are an expert.
I mean... I'm sure, hopefully the person is not going to get offended. I've had a patient not long ago, not going to say any names, that walked in with a program designed by ChatGPT.
Really?
And no matter how I can say this, she put her face into ChatGPT. Hopefully the person is not going to get upset for this, but I'm going to say she put her face, a picture of her face into ChatGPT and asked ChatGPT what I need. And when she came to see me...
And what did they say? How do you feel about what ChatGPT said?
It's mad.
Really?
It's crazy. Think about it, like as a practitioner, what we do, we assess you, not aerostatic, but dynamic also. So in my clinic, I have the way I set the treatment bed, my chair and the light, I set in such a way that when I see my patient in front of me, I, on purpose, this is like my standard, I chat with someone for 5-10 minutes. How's your dog? How's your cat? How's your mom? Thank you for coming to see me. It was lovely. Thank you. And that 5-10 minutes before I actually consult, I want to see how you move.
Right.
I want to see how your lips move. I want to see how you smile. I want to see how your face moves. Then we create a program. But if I put a static picture into ChatGPT, that computer is not going to know how you smile.
Yeah.
And she said, oh, I want my lips like that. ChatGPT told me that I have to leave my lips. Can you put 0.2 4 millimeters depth on the commisure of my lip? I thought, girl, wow, we are in trouble here.
Oh my goodness. Okay, right. We can talk more about patients now as well, because we're going to talk about clinic philosophy in practice and patient reality.
Yeah.
So in your clinic, you often say beauty is for everyone.
Yeah.
What does that look like? And also when you have patients coming in who... I think it's quite overwhelming, the whole aesthetic industry. I think there are so many treatments. And what about those people that are really just overwhelmed by it? And also a lot of people are scared of needles. A lot of people are so anxious and nervous coming into you probably.
Yeah.
How do you deal with those sort of patients?
So the reality is that expectations these days through social media, it's quite something.
It's crazy, isn't
right?
it? Yeah.
I feel
you're very active on social media as well.
I try.
You're very active.
I love it.
You get in there with the comments too. I love it.
I love it. I just have to get in there and give my thought. But I feel that the patients these days, oh my God, the expectations is insane. So like, everybody wants to look like a retouched picture, or everybody wants to look like so I think we have to make sure that, we set standards from the moment we sit on consultation.
Yes.
What we can and cannot do, what is achievable, what is not achievable, what can we do, what we cannot do. So we have to set standards from the beginning.
Yeah.
Because patient expectations are insane these days.
Yeah. And is it a lovely feeling? Because I know how I feel when I go and get treatments, and I'm already coming in with, you know, my confidence level is okay. For those who don't,
hello, look the way you look. I would too.
But I still feel so amazing after a treatment. That as a practitioner and doing these things, like the reaction that you get from those type of patients, where you really do kind of transform them.
It's wonderful. It's so satisfying, you know, like, because a lot of people out there, especially people that they're not educated in this field, you know, sometimes they comment, oh, you know, why are you doing these things, or why are you having that done, or why you have this done. But sometimes, you know, like when you know, they have to look deeper. Like, you can really sometimes just change someone's life by giving them back some confidence through maybe some life experience. They might have gone through a divorce, or they might have gone through a loss, or, you know, they might have had an accident, or they might have something that's been, you know, bothering them for so long. And to be able to modify or to give them back a little bit of that confidence, it's beautiful.
It's priceless, isn't it?
It's priceless, really, yeah. You know, we have had quite a few throughout the years, you know, and it always seems to be, I always say, like, especially female and male, by the way, both.
Yeah,
When they go through a separation, for example, a divorce or something like that, you know, you always feel like, what's wrong with me? Am I not pretty enough, or whatever?
Yeah, you lose your confidence.
So just give them tiny bit of confidence back. You put them back in, you know, in a good state. So it's wonderful.
Yeah,
wonderful.
I honestly think it's such a, to go and do aesthetics. It's like, you know, it's changed so much now. You know, before, years and years ago, it was, you know, you could come out looking a little bit different, but now you just don't. You come out looking better.
You do. And do you know, I always say the best work in general, I mean, I don't judge anybody, like whatever people want to look like, you know, good for them. If they don't hurt anyone and they want to look in a sort of way, just go for it, I say. But the reality is that the best work, especially when it comes to the medical aesthetic field, is what we call it be undetectable. So, you know, it's the work that you look like you, but just better version and fresher.
Yeah.
And I think
you want it so that people, when they see you, they say, "Oh, you look so good."
Right?
Yeah. Instead of, "You look different. What did you do?"
but that's the best. That's the best thing. I always feel that if you walking through a room or in a room, and someone says, "Oh my God, girl, what have you done?" Or, "Oh, what?" You know that probably the work it wasn't done properly, but. Exactly that. If you know, you wanna just be the best version of yourself, really, you know.
Yeah.
And these days we can, so why not?
Exactly.
If it makes you feel better and it gives you confidence, why not?
Yeah, exactly.
Right?
So you've had your clinic for 16 years.
Yes.
Such a long time.
Yeah.
For those people that maybe are either thinking or they're just starting out with their clinics now, what's a key piece of advice you could give them?
What a wonderful question.
I'm sure there's a lot. I'm sure there's,
I would probably say, out of the way that I love the industry, I then again, I said at the beginning, I feel very fortunate to do something that I'm passionate about. I don't wear a watch. When I'm at work, I never, ever look at the time, right? Never. I don't know if it's 7 o'clock, if it's 8 o'clock, I just do. And I always feel if you new at this and you want to go into this industry, please do it because you love the industry, because you're passionate about, because you want to learn, you want to make sure you keep yourself updated all the time. Don't just go in with the promise of, oh, you're going to make thousands of pounds doing that, because the reality you won't. So I say go in because you want to do it because you love it, because something that you're passionate about, and that the success will come.
Yeah.
You know, if you're good at doing what you do. So don't trust providers or trainings academies that they just go like, oh, come and do 2 days course, you're going to earn 100 grand next year. Because I see this all the time on social media.
I bet, yeah.
Don't do it for that reason. So do it because you love it. Do it because you want to keep yourself updated.
Yeah.
Do it for the passion for the industry, you know.
I was going to ask you as well about clinics, the pressure of becoming transactional. I think there's a lot of, and I've been to clinics where it does feel transactional, and your clinic is very the opposite of that. How do you, I mean, you obviously, because you're so passionate about it, and you're even advising, you're telling, you know, practitioners that you're training, don't get into it for the money. How do, and that's the only way, isn't it, really, to avoid being transactional?
Do you know, it's funny though, I feel these days people are, well, they're way more educated in a sense, you know, with social media, with ChatGPT, with all these things. And I feel people know, I always say to all, even my staff, you know, people like that, they're not stupid. You know, when you treat them in a sort of way, and you might be able to fool someone once, maybe twice, but these days people, you know, they know. So I think it's not a good business move really to be transactional at all. I think if you care for your patients, because at the end of the day, that's the main thing. You care for them. You know, we're here not just to do pum, 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 but to follow them through a journey. You know, when you care because you want them for real to look better, you want them for real to feel better, they feel it. You know, patients these days, they know. So if you just do a transaction like, you know, 250, they know that. And eventually they won't come back again, you know. So I think if you practicing this or any business differently, like, you know, you do it because you want them to look better and you want to care for them, you know, the patient will feel
that,
it. And when you just do it transactionally like that, I think it's never a good move. It's never,
No.
it's not a sustainable business, is it? You know, it's a short, I always say it's a very short, anything you do just for that is a very short-lived business, because people these days, they can go next door.
Yeah, of course. There are so many now.
So many, one in every corner.
They're everywhere. Tell me a little bit about your podcast, because the Aesthetic Effect podcast, I love listening to that. That, you know, I'm just starting out here with, you know, the Aesthetic Today podcast, and we had such a wonderful chat, and I really enjoyed it, because you've been doing a podcast, and, you know, you had some great tips for me. How you're not doing your podcast at the moment, I know, because you're so busy. I don't know how you fit everything in. I know, seriously.
We will start again, because I absolutely loved it. I think, the podcast was born to trying to highlight just to talk to people in the industry, to just maybe like highlight things that other people won't talk about, or to interview, for example, like practitioners and doctors and nurses, and so just to hear their stories. And so it was the effect, the name is the effect of, so you know, it was just to highlight some, you know, subjects and arguments and things that maybe other people won't talk about. And I loved it, to be honest. And I'm looking forward to go back into it, I think, at the end of the year.
How did you find, did you ever, talking to all of those other, you know, your peers, did anything change on, you know, maybe there was a treatment you didn't agree with or you didn't like or things like that? Did it change your perspective on certain things?
Oh my God, yeah. I think if we all agree, like, you know, when in social media, when I comment on stuff, you know, if we all agree on the same thing, I mean, there will not be a growth. You know, there will be a discussion. So we have to disagree. You know, like the things that I do that I might say that maybe other people are there, they're going to look and go like, what is he saying there? But that's growth. And sometimes, like, when I spoke to some colleagues, you know, I might thinking, really? You know, that is really what you think. But then again, it's about growing. And sometimes I change my perspective as well. Oh my God. When we do training, for example, like I always say to, you know, people in the room, is that I don't know everything at all. I'm still growing and learning every day. So sometimes I just, you know, I'm stuck into this glass. It's lovely. But then somebody else show me a different side of it. And I'm thinking, maybe I should do it that way.
And that's and I think that's great that you're getting that experience, because maybe not all practitioners get that. You know?
I think if the day that we think that we know everything, the day that we think that what we do is the best, I think we have an issue.
You want to keep learning all the time.
I think we have an issue. I think it's good to you know, disagree. I think it's nice. I mean, you know, like you learn, and it makes you question yourself as well. You know, sometimes during training, I see someone, you know, I might say to someone in my room, get the syringe that way or inject this way. And I've had this quite a few times actually. And a practitioner will say, well, but why you don't do it this way? Because actually, if you inject in the, I'm thinking, that's correct. I never thought about that. So
I love that.
I definitely pick from other people and so on. And I think conversations, from other peers and stuff, it's great.
It's important, isn't it?
Oh my God, yeah. Disagree is part of growth.
Yeah.
Yeah.
Right, let's talk about the future of aesthetics.
Yes.
Because it's moving so fast. Do you see problems with the speed at which the industry is moving? Maybe in the education system or...
So in education, for sure, I really would love, because this industry is becoming so big and because there's a lot of more practitioners in general, then again, from healthcare background and non-healthcare background, I really would love for a standardization, that's what you say in English?
Standardized
Studies and education for me.
Right.
So that's something I would love because it's moving so fast and there's so many people doing this job. So that would be definitely one. And I think the industry, again, is just moving towards regenerative. Everything is about skin.
Yes.
So it's moving quite fast. But I think this regenerative side of it, I think is here to stay. So I think it's going to grow still, but I think towards more of a natural regenerative biostimulation kind of treatments and so I think I believe.
It's a great direction for it to be going in.
Yeah, because everybody wants to look more natural.
Yeah.
Everybody wants to look the best version of themselves without being, fully transformed.
Let's talk a little bit about laws and regulations.
Yes.
Because it's a very hot topic at the moment. Because there's a lot of changes coming in. Yeah, and there was a change. I think it was Scotland that had a new regulation come in recently.
Yes.
Are we going to see that over here in England?
So this is something that has been going on for a while. And it's something that, everybody's been worried and scared about, when it's happening. When it's been a talk of a minute. But in Scotland, it's gone through. So Parliament has passed it. And it's actually, I think in May 9th or something, it's actually became active. What that means is that, for what my understanding is, because things that keep changing, is that we're moving towards a level 7 fix education for everybody. So that means that if you're performing treatments and if you're injecting a patient or if you're just using a needle that penetrates up to a dermal layer, you have to be licensed. That's what it is. And in Scotland, they have introduced a license scheme program, which I think is great.
So at the moment, you don't have to be licensed.
In England, not yet, but it's coming. It's only a matter of time. The way it will work, for what we know, is that you have a program of light. So you got a green, a red, and an amber. Green is for light treatments. Red is for injectable treatments, and amber is for severe, like something that is more like aggressive, something that needs a CQC environment, like a minor operations and so.
Right.
Practitioner will have to be licensed. That means that they're gonna have to have a number. And to get this license, you have to show that you have done your level 7, which is the highest
which
level
is what we
you
were
can
speaking
get.
about earlier.
Yeah. And then if you're coming from a non-healthcare background, apparently the rumors are that you have to be under the supervision of a healthcare professional to be able to perform some treatments within your practice. I think it's great. And I think we need to have something like that because at the moment, anyone, literally,
it's a bit of a Wild West, isn't it?
Can go and do a 2 days course with someone that trained themselves 3 days prior, get a piece of paper and inject people's faces, it's mad. So the legislations, the license scheme, the red, the green, red and amber program is definitely coming. I think it's going to be a good thing, not a bad thing.
Good.
At least we're going to get some sort of regulated industry.
We need it, don't we?
I have a friend that works within the CPD, continuous program development, professional development, and she said to me, this is quite awful, that they get people calling to register the courses. So when you have a course, like I do master classes is a class that it's an hour. It's 6 to 8 hours where someone will come to see you, already practitioners, and they just learn a new technique, or they learn,
and that's like a private one-to-one.
A one-to-one or in classes, but we can give points, right? So every class that we do, the practitioner will get 6 points or 8 points, depends on the course, and that will go towards your license, right? That's the way it works. And I have a friend of mine that works in the CPD, and she said to me that sometimes they get practitioners calling to register some of their master classes, either be fillers or either be mesotherapy, whatever it is. And then when you register your courses, they will, you have to give the course, you have to give, the hands out, whatever you do on that day, they have to assess and make sure that is, standard for you to give this point, and then register yourself and get your number and so on. When the practitioners register themselves, they have to send their own qualifications to them with the insurance also, to make sure that you are actually a qualified and insured practitioner, right? And they get these certificates and they are registering a course. I don't know, today is the 11th of May or whatever it is. And they just got their certifications for dermophilers or whatever, like 3 days before. So they will come back and say, but wait a minute, you are teaching someone how to inject a lip or how to do whatever, but you just been trained a week ago. So it's like, but legally, they're registered.
Is it allowed?
Well, put it this way, they have a certification themselves, they have an insurance, so legally, they can. But if you think about the principle, how can someone teach someone? They just learned the week
they don't
before.
Have the experience in.
It's insane.
Wow.
It's insane. Yeah, it's crazy. It's mad.
Well, hopefully, the new regulations that are coming in are really going to help this kind of stuff that's going on.
I think in England there's a real need now for change. We have to make sure that and I'm happy with that. I know my limitations, and so I know what I can and cannot do, and I'm happy with that.
Yeah.
I feel that it's just becoming too much.
Yeah.
It's just becoming too much. I mean, I've had patients. I shouldn't say these things, but it's quite probably. I've had patients that I don't see them for a few months, and then I might see a friend or whatever, and I'm like, oh, I haven't seen Mark or Julia or Francesco, and I started oh yeah, do you know what? Oh yeah, they now just open a clinic, and I'm thinking, so they just went to 2 days course, and they now do. So we need regulations are needed. Regulations are needed.
I think so. We've save face.
Yes.
Yeah.
Yeah.
That's amazing, the work she does.
Yeah.
It really is, because people are getting injured.
Yeah, they are. It's about, to me, we come back in the same things. It's about standards, patient safety standards. I am a great believer, and we said this at the beginning of the conversation, that, I'm going to say it. A title, in my opinion, does not always give quality. Means that just because you have a DR in front of your name, or just because you are a nurse or a medical therapist or whatever you are, doesn't automatically means that you're good at what you do. So we have to go back and say that, to me, it's about training and qualifications, not a title. Because remember, I always say to all my students in general, if you got a bad tooth, you're not going to go to a gynecologist, are you? If you have something that wrong with your knee, you're not going to go and see a dentist, right? So a title doesn't automatically mean, just because someone says I'm a doctor or I'm a nurse or I'm a physiotherapist or whatever, doesn't automatically means that that person is being trained to perform medical aesthetic treatments.
Yeah, so, it can be a little bit misleading. I suppose. Yeah. Do you get any patients coming in that have been botched by other people?
I have, yes. The answer is yes.
You've got to fix.
The answer is yes. Sometimes the only way to say, I feel in the past was mostly lips.
Because everyone wants their lips done. So I think beauticians, people maybe that weren't fully qualified in it, were just making a lot of money from it.
But you know the funny thing as well, honestly speaking, like I find lips to be one of the hardest thing to do.
I agree with you.
And it's the first thing that people learn. And do you know, for someone that has been in the industry for so many years, I still find lips one of the hardest area to treat. And that's the first thing that people learn.
Yeah.
And I see them on Instagram, pam, 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 pam.
Yeah.
And they're all lip specialists. And I'm thinking, wow. So lips is one of the things that probably I have had to treat or dissolve or, trying to fix.
How do you dissolve? It's a how do you dissolve?
Hyaluronidase.
Oh, yeah.
It's an enzyme.
It's tricky, isn't it, as well?
And it is an enzyme that we already as human produce, by the way. So we're already producing it ourselves. But when it's injected chemically, so when it's injected, it just breaks down the connection the molecule have. So you kind of like open the hyaluronic acid up and then your body will absorb. And it's great. I mean, for complications, it's life-saving. I mean, you say patient, like it's something that, everybody should have in their own cabinet.
Right. Is that for maybe when you were speaking earlier about the dangers of the liquid nose job with the eye, is that something that if you had a complication there, is that the product that you use?
Oh my God, yes. So hyaluronidase is something that every practitioner should have an emergency box ready. Everybody, mine sits there ready. And
Dr. Roberto said that on your show. He said the first thing patients ask when they go in, they shouldn't be asking about the price of the treatment. It should be, do you have hyaluronidase?
I mean, that's the most important thing. You should have your emergency box ready with your aspirins, your hyaluronidase, your water dilutions, your syringe, your needles. It should be ready because, thanks God, I personally, I don't really see, because I'm very conscious as an injector. I inject very little. I don't inject too much filler in the first session. I like to spread things maybe 2-3 times. So I'm a very cautious injector. So I don't really have, I mean, I know it's going to sound crazy because I treat so many people. I don't really see complication of this kind. Maybe I've been lucky so far. One day I will. It happens to everybody. But I think you have to have that. You have to have your hyaluronidase to be able to dissolve filler. And when it comes to nose, oh my God. I mean, that should be the first thing that you do. I have a little story about nose if you want to hear it.
Go on, tell us. We always want a story.
Are you ready for this?
Yes.
I'm going to make it quick, I promise. Very good friend of mine. And then again, this is just to go back to the title, right? So I always say that a profession, so just because someone has a DR in front of the name or just because someone is a nurse or has been working in the NHS for 20 years doesn't mean that they are automatically trained into performing study treatments. Having said that, I'm not promoting as well the other thing, right? Having healthcare background, it does definitely help because you've been in clinical environment, you know how to deal with complications, you know how to deal with some faints or whatever. So it's great. I'm not saying that you shouldn't. But what I'm saying is that a title doesn't automatically mean that someone is trained. So someone that I know went to a college, a training academy in central London, and they went in for a non-surgical anaplastic. And this specific academy only trains doctors and nurses, healthcare background.
So she was being one of the models.
A model. Sorry, apology. Yes. Yeah. Correct. Yeah, she was a model.
Brave woman.
Very brave. And I know her really well, and she's a lovely, lovely girl. And anyway, she went there. She'd been there before. She had the lips done there before, so she was happy with that. It just happened she went there, had her nose done, and this day I want to reinforce and say there was just medical only. So it was actually a doctor day. It was not even nurses or dentists or nurses, or it was doctor day. And so anyway, did the nose. And straight away, she felt quite severe pain. And she communicated with the doctors and said like, oh, this feels really painful. Is it normal? And everybody was like, yeah, it's all great. It's all normal. It happens. The nose is very sensitive. It's a small area. And so anyway, an hour later, she was still in the reception room, and she felt really a weird, severe pain. And she was told to go home. It was all great. It's normal. All normal. So she went home. It was a Saturday. Now the college on a Sundays they were closed on that specific weekend. So then I was away that weekend. Anyway, I got a phone call from her and I said, Flavio, late at night, I said, Flavio, my nose is really, really painful. And I'm starting to feel some sort of severe pain around my eyebrow area. Is that normal? And I said straight away, oh God, that doesn't sound good. It shouldn't be that painful. So I said, can you go back tomorrow and see them straight away? And she said, well, they're closed. So I said, you're going to have to find someone that potentially can dissolve or see you. So anyway, she went to see a friend. I'm going to make the story be short. She went to see a friend. She's a practitioner. She did a little bit of dissolving for her, but she didn't really know what she was doing. She tried her best, but it didn't quite do it. So on a Sunday evening, the tip starting to get quite red. By the Monday morning, the tip was really red, and now you can see a track and traveling down to the cheek area as well. So clearly an occlusion.
An occlusion of the
artery. So she went back to see them on Monday morning because I told them go straight there on Monday. So she went there on Monday. Thanks God, there was a doctor one of the trainers there. She was seen by this doctor, and the doctor basically told her it was all great, it was all fine. Gave her no aspirin, no blood thinners at this point, which is something that we all learn first thing you do. And just in case, gave her a little bit of hyaluronidase on the nose. One flash, quick, send her back home. Following day, more pain. Back of the eye was very painful. At this point, the tip was getting darker and darker and darker. So on a Tuesday, she went back there. And again, they saw her, did not much. The tip was getting darker. The marker on the cheek was getting darker. And at this point, again, one little flash of hyaluronidase, quickly sent back home again. So she called me, she said, Flavio, this is not normal. So I had to call a friend of mine. She's an amazing nurse. I mean, incredible nurse. She's been doing this for 30 years. And one of her best friends works for ACE, which is the Department of Emergency for for the aesthetic industry. They send her immediately to the ophthalmic hospital. And they found out she had a massive blockage. And thanks God, that did not reach the ophthalmic artery at this point.
What could it have done to her?
Blind.
Oh, my goodness.
Blind. So she went back to the college. ACE had to call the college. And make sure that she was seen immediately. 3 flashes until that tissue regained color. So we have to pursue these people to give her the right, to do the right process. So I come back to the initial point. Sometimes, just because someone has a name in front of it doesn't mean that they're trained to do that. And this friend of mine, she could have, lost an eye or so. But thanks God, they paid for some oxygen therapy. And now she has a little bit of scar tissue, which they're going to have to open it and file down, which they're going to pay for it. So they took responsibility.
Okay.
Yeah, they took responsibility at the end.
I mean, you do hear these stories though, don't you?
Yeah.
But that's quite shocking that it happened in that type of place.
That's exactly my point. So my point was that sometimes you have to be trained into that. And it's fine. Sometimes, just because you work within the NHS or whatever, doesn't mean that you've been trained on, studying medical complications. So that's why we have to go back and all go back to school.
Yes, I agree with you. It sounds like a good idea. Okay. Yeah. Finally, Flavio.
Yes.
When you strip back everything, what do you want your work at Fiore to ultimately be known for?
Quality. And quality, but most importantly, I want to be known as someone that actually cares for the people that walk through my door. Because I really do.
I know you do.
Because I really do. I want to make sure that I do the best job that I can do, the best quality job that I can do. And I would love to think that my patient feel safe and feel cared. Yeah. And that's ultimately what I would like people to to say about me. Quality.
I bet that's what they all say. I just get the feeling.
So yeah, that'd be amazing.
Flavio, thank you so much. This has been wonderful to talk to you.
Can I just say I had the best time? I can do this for another 5 hours.
I know, we could talk for longer, couldn't we?
Yeah, but I had the best time. Thank you so much for inviting me over. I had the best time. Hopefully we can do this again soon.
Hopefully we will, yeah. Another catch up in another couple of years.
Yes, I mean. Thank you so much. Thank you.
Thank you so much for joining us today. Please, if you liked the video, if you liked our episode here with Flavio, like it, share it, and we'll be back again soon. Thank you.